This month we're going to talk about overuse injuries and how physical therapy interventions can be helpful for those overuse injuries. Typical overuse injuries that we're going to see in our clinic are tennis elbow or lateral epicondylitis, shoulder rotator cuff tendonitis, and patellar tendonitis, just to name a few. Most often when patients see us at their first visit, they've tried many interventions on their own to reduce pain, such as using ice, over-the-counter anti-inflammatories, and often resting. Depending on what their inflammation and tissue irritation is like, we may add other modalities to help reduce their inflammation if it's at a high level, such as using ultrasound or iontophoresis. But the primary intervention that's going to help the patients long-term and allow them to return to their activities is finding the right dosage of exercise. We will identify if they have any deficiencies in their flexibility and in their strength, and then we'll find the right dosage of repetitions, sets, resistance, so that the patient can rebuild the injured region without continuing to overuse the overused tissues. And ultimately, the patient needs to be able to regain the sufficient strength level so they can return to their desired activities and meet the demands of their physical activities that they were originally being overused at with their daily activities, or maybe it's their sporting activities. So the real key from the physical therapy standpoint is the therapist helping them through that process and rebuilding their strength at the appropriate rate at which their tissues can handle. If you have any other questions about overuse injuries, please contact Jet Physical Therapy.